The question here is, which enzyme plays an important role in regulating body glucose levels after feeding or after eating? So what happens after eating? Blood glucose level rises. Now with the help of GLUT2, GLUT2 receptors, this excess glucose is taken up by both tissues of the body. Parallelly, it is also taken up by the liver and also the pancreas. And in the pancreas, we have beta cells of the pancreas which take up this glucose. Now tissues, they use this glucose for energy purposes. But what does liver do? Liver, with the help of an enzyme called glucokinase, it converts this glucose into glucose 6-phosphate. Glucose 6-phosphate. Here comes the catch. This enzyme is very important enzyme which helps in regulation of the blood glucose levels. It is a sensor. It is a glucose sensor. The same reaction also occurs in the tissues. The glucose is converted into glucose 6-phosphate, but here the enzyme is hexokinase. Hexokinase and glucokinase, they might sound similar, but there are characteristic differences between hexo and gluco, right, based on Km and Vmax value. Let's not get into so much details of it, but what you need to remember is this hexokinase is inhibited by G6P, but glucokinase is not inhibited by G6P, that is glucose 6-phosphate. This is allosteric inhibition occurs in hexokinase, do not occur in glucokinase. That is, the property of glucokinase itself is designed in such a way any excess blood glucose is converted by the liver into the other forms, maybe glycogen, maybe adipogenic potential, fat synthesis, everything like the glucose is used up here. Similarly, in the pancreatic B cells also, synthesis of insulin occurs whenever there is excess glucose. So insulin secretion occurs in the pancreatic cell. The same glucokinase helps in formation of the insulin. Now you see, in the examples in the question, they are asking you which enzyme plays an important role. So it is glucokinase. It is not glucose 6-phosphatase or phosphofructokinase or pyruvate kinase. All these are glycolysis reactions, right, in the reaction. But the major enzyme which is very important in regulating the blood glucose levels of the body is glucokinase, and this glucokinase versus hexokinase is an important topic of discussion. Okay, it is very important. So let's try to differentiate these two. Location wise, as I already told you, glucokinase is in the liver and pancreas, hexokinase is in all the tissues. Now we have Vmax and also Michaelis-Menten constant Km. The glucokinase, both Vmax and Km are high. See, what does Km infer? It tells you about the affinity. So when I say affinity, when Km is high, affinity is low. So Km is inversely proportional to affinity. When Km is low, affinity is high. I can very confidently say that hexokinase, which is present in the tissues, has high affinity to the glucose. That means even if minimal glucose in the body is available, it is taken up by the cardiac muscle, because heart needs to function, brain needs to function. So all the tissues in the body, irrespective of the level of the glucose, they take up all amount of the glucose. So this is hexokinase. But affinity is very low for glucokinase. What does liver do? Liver, the glucokinase gets activated only when the blood glucose levels are high. Because affinity is very low. Similarly, Vmax is also low. The reaction rate is also low. Now, these three differences are okay, but one more important difference is allosteric inhibition by G6P. It does not occur in glucokinase, it occurs in hexokinase. Please remember these four characteristic differences. This is very important.